Stacie, thanks for joining me.
Thank you, Lisa.
I appreciate it. I have a lot of questions to ask you.
All right,
let's get started. Tell me about yourself and about your experience, and how did you get to Livio?
I was in the corporate world for most of my career and met you in 2016, and you were my injector, and I was just...
How'd I do?
Well, I don't know. You all can tell me. It was amazing. I was just enthralled by the whole industry, and I remember asking you, I said, what do I need to do to be able to do this? And you told me it was going to be a long road, and you were correct, but I have loved every second of it. So I went to the Aveda Institute in Soho in New York City, my aesthetics certification from there, and then I went into nursing at Mount Sinai, and also did a clinical research fellowship there. So that kind of started my journey. We've stayed in touch ever since. So this has been a passion of mine, and have done derm, plastics, and injecting for quite a few years now.
Yeah, super psyched you finally came back.
Thanks for having me.
Yeah, my pleasure. So tell me, if you were just to describe an expert in the field, how would you describe someone like that?
I would say an expert in the field is somebody who is truly passionate about it, because this field is always changing. So you have to really be into it, want to be reading about it, studying it, being on the cutting edge. It's not something where you can just kind of sit back and stay in your ways. There's always something new. So I think certainly having that passion, but also understanding the science, understanding the art of it, understanding the anatomy, studying these things for years and years and years. It's not something that you just kind of do once and forget about. I mean, we're always looking at new techniques and safety zones and danger zones and new ways of using Botox and fillers in certain areas. And there's just always something new coming down the pike. And then as far as understanding all of that and then being able to articulate it to a patient in a way that makes sense to them, it hits their goals and, on time and on budget. So there's a lot of things, and I think you can attest to this, that are going through our heads as we're injecting.
Right.
Every line, every muscle, every
Shadow.
vessel, all of that is going this quick through our minds as we're doing it.
Right.
And I think to do it effectively and make it look easy, because it's certainly not, is somebody who is really an expert in that field.
Yeah. Talk to me about what kind of training you've gone through, both formal and informal.
Yeah, there's a lot of trainings out there, and some, better than others. I love the hands-on for sure. I'm very lucky to work with a trainer. So Lisa is a trainer here, so I could not be any luckier to work with somebody who is distinguished in the field. So I learn from you every day, and colleagues. There's the Allergan Institute, so I've been part of the master series for that. ASPS, iSpan. I'm also, both of us are also CAN certified, which means Certified Aesthetic Nurse Specialist. So you have to work within an industry for so long, sit for a test, and be vetted. So it is a nice little feather in the cap for something that's a little bit different, that we had to kind of go above and beyond for, and go us for doing that. But we're always studying something.
Yeah, that's for sure. Always studying. Yeah. So you've been a provider, an injector for a lot of years. What experiences have shaped the way you approach patient consults and patient treatments?
One of the things that I learned in my kind of corporate life that I have used in pretty much everything is this 30-second, 3-minute, 3-hour mantra on to really be an expert, which was a question previously, is you need to understand the 3-hour conversation. So you need to have the knowledge to be able to talk about the nitty-gritty details of what you're doing. And then you may only have 30 seconds with a patient, or maybe that's all they really care to talk about, because they'd rather talk about their kid in school. They don't really want to know about all the medical stuff that we know. So how do you take your knowledge that you've been studying for years and dial that down to a 30-second or 3-minute conversation? And so kind of gauging with the patient where they're at. Of course, understanding what the true goal is. You may, I hand a patient a mirror and I say, show me what your concerns are. And it may be, this one thing that's bothering you, but in the grand scheme of things, it could be multifaceted. Right? And it's really uncovering that true concern for the patient so that they're delighted when they leave. Not just happy, but delighted and feel educated. They learned something new and felt like it was something above and beyond that they could get somewhere else.
Yeah, I love that. So Botox has been around for a very long time. What are some of the new treatments that are available to patients these days?
I'm super excited about lower face. I think it's great. I mean, we all love the forehead and, between the brows and the 11s and things, but I'm so pumped about the lower jaw area into the platysmal bands, treating the chin, treating the lips. So it's smaller amounts of units, but those little tweaks can do a lot of things. So it doesn't always have to be filler to shape a jawline. You can just relax some muscles, some masseters.
Yeah.
Quality of life increase there, but also aesthetically just beautiful on how you can change the shape of somebody's face by relaxing and taking away versus adding. I'm also really curious to see from a skincare perspective what's coming out when people are talking about melasma or talking about rosacea or these kind of inflammatory processes.
Right, scar reduction,
yes,
things like that.
Absolutely. Yep. Acne, hyperhidrosis. How do we use it to treat things that are really challenging for people?
Yep.
And I think that's really the next step for Botox that I'm excited about.
Yeah, me too. So tell me, what is one or two or three of the ways that you build trust with patients when they're nervous, come in for the first time potentially? What do you say to them? How do you alleviate those concerns?
Well, our consults are free. So it's certainly a place we want you to come in, feel comfortable. It can be a little nerve-wracking. We understand for sure. I remember my first time.
Me too.
It was probably, you did it. And I was like, has it kicked in yet? But understanding that you're not the only person it's a first time, right? We're there to guide and support. There's no obligation. And we want you to feel excited about a treatment and ask all the questions. And I like to actually show patients by doing this is what should happen. So we have that expectation together of, if you're letting me kind of guide you, it may be a little bit different than what you initially thought. Maybe the plan's a little bit different, but you trust me as the provider to do that. The expert to do that. And then when it happens, it's magic. It's a trust the process, and when patients allow us to do that, it's such a great symbiotic relationship there.
So for those patients who may have never tried Botox before, kind of sitting on the fence, what would you say to them?
Well, first of all, there's a lot of people who have Botox that aren't saying probably that they have it. So there's a lot of people who've already been treated. So if you're worried about somebody thinking something one way or the other.
Or even noticing.
There's probably half your friends already have it. But I would say come in with your questions. And, nothing is permanent.
Right.
You can try it. I'm sure you'd love it, but if for some reason you don't, it just goes back to baseline. So it's not changing anything about you. It's just making you look refreshed, and it's just a tool in the toolbox for anti-aging, and everybody's doing it.
For sure. So if people want to learn more about Botox treatments or more about Livio Med Spa, how can they get in touch? How can they find that information?
Certainly go to our website. That's a great place. There's a lot of good information on there. Our Instagram is fabulous. There's all sorts of videos and things that can help. We post on there different deals that are out there. Subscribing to Ally, which is the free Allergan Botox and Juvederm program, is great. There's a lot of great resources in there that you can look around. We have a fabulous front desk, so you can always call. We really do. We really do. And she's very knowledgeable and can certainly help you get to the right place. But yeah, the easiest thing is if you have a question, just call us or come on in.
Great. Thanks a lot. I really appreciate your time.
Thank you.
Okay.